So if you are pregnant and you are feeling pain in the pelvic region, so I've got models today. So this is our pelvis, okay? If you have pain anywhere in this area, there is and are some things that you can do to get relief during your pregnancy. You don't have to just live with pain. Physical therapy is here to help for that. So today we are going to talk about one very common pelvic pain though, which is called pubic symphysis dysfunction. And the pubic symphysis is this area of the body right here in front. Is it commonly kind of right in the lower groin area, right above the pubic bone is where a lot of women will have pain. So kind of right up in this area or even right over the pubic bone region. We hear a lot of times that there's pain in this area really bothering women, making them unable to stand, walk, those kinds of symptoms. So one thing about this area of the body is this is a extremely stable joint, and it takes a lot of load in our bodies, especially when we're pregnant. It gets even more load to it. And one of the reasons why women can get pain in this pubic area and can get pubic symphysis dysfunction is that, you know, we've got a lot of hormones going in our bodies. And so for some women, the extra laxity in the ligaments causes things to kind of slip and shift in this area. Causing, you know, things to come out of alignment, things to move too much, or just be strained too much, which then results in pain. It's thought that about up to 1 in 4 women have pubic symphysis dysfunction at any time during their pregnancy. So it's really, really common. And there are things that you can do for it, which we will talk about in just a second. So some of the common symptoms that we hear about associated with pubic symphysis dysfunction is obviously pain. Pain's number one. But you'll have like a waddling type gait when you walk. So you feel like you're a little bit more unsteady and you shift kind of side to side more often, because if you try to shift and move normally through your pelvis, it hurts. Pain can be with walking, pain can be with climbing stairs, pain can be with sitting or standing for a long period of time. Even simple things that you do every day, like getting up to get out of bed, getting in and out of the car. I hear women tell me every time I put my pants or my socks on, I can't get one leg in because it hurts too bad in that front part of my pelvis. Those are very, very, very common complaints with pubic symphysis dysfunction. Even if you have pain here, you may also have pain on other parts of the pelvis as well. So, you know, you can also complain of lower back pain, lower abdominal pain, and even leg pain associated with this type of pelvic pain. So it doesn't have to be just this pain alone. You might also have back pain or hip pain with it, okay? So physical therapy, of course, is a great treatment for this and a great option for women to get more comfortable during their pregnancy. We look at what's going on around the pelvis and see, hi Brooke, see what's going on kind of near the pelvic area and see kind of why are you experiencing the pain that you're feeling here. Treatment may include mobilizing the tissues or massaging the tissues around the area, strengthening and stabilizing the pelvis, which is really key. We could do different stretches, different exercises. We also teach you how to move your body in a way that's more comfortable. So it might come down to looking at your posture, teaching you different ways of lifting, carrying, especially if you're a mom of multiples and moms with little ones. You know, carrying your toddler while you are pregnant and dealing with pubic pain and pubic symphysis pain is awful. So we teach you how to safely move and load your body so you can keep pain at bay. There are also braces and supports that you can use. They vary in nature and they vary in purpose. And so it's best to partner with a trained pelvic physical therapist or women's health physical therapist to determine which brace or maternity support is best for you to help with your specific type of pain. But there are braces out there and they can be hugely helpful for women just to get more comfortable and get more support, but definitely see a trained physical therapist to get the right one for you. So get PT, of course, and then definitely talk to a trained provider about supports and bracing. But the things that you can do on your own or things that you might be able to do at home to help remedy your pain. Number one is ice. And most women don't think to put ice on their pubic area. Okay, we're talking about outside. So take I love a frozen bag of peas or frozen bag of corn and you just put it right over the pubic area. So it's outside the body. 10 to 15 minutes at a time can be really, really helpful, kind of doing that through the day. So don't be afraid to ice this area to help with calming down pain. The thing I teach my patients all the time when they come in with pubic symphysis dysfunction is to move differently and move carefully. So I explain to women that will want to move like Pac-Man, or like you have a pencil skirt on. So keeping the legs together to avoid any additional shearing forces is going to help minimize pain and discomfort. So a couple for instances with that. Avoid really deep squats. Really deep squats pull the pelvis and can create more pubic and pelvic pain. So, if you're a squatter, we want you to keep exercising, but maybe you do a more shallow squat, or you don't load up your squat so heavy if it's causing pain. So try to avoid deep squats to avoid that open and kind of sheared position on the pelvis. When you are getting into and out of your car, think about keeping your legs together. So when you go to enter your car, turn sideways, sit your bottom down on the seat, and then keeping your legs together, lift them into the vehicle. Then when you're getting out, do the exact opposite. Lift your legs together over to the side and then stand up. So your best bet to try to keep your legs together as much as possible when you are doing movement patterns versus trying to splay or pull the legs apart, because that's just going to pull right on that pubic area. Other things you can do as much as possible is to avoid excessive stair climbing. So if you have the option to take an elevator, take the elevator. If you can't not take stairs, then try to do them one step at a time, where you're going up foot over foot versus one, then the other. If you are unable to not do stairs at all, then just make sure that you are not adding too much extra load on your body. So if you do have a toddler or a little one that can walk up the stairs versus be carried, do your best to try to get them to walk. In my house, that always doesn't work, but do your best to help them walk up the stairs. If you know you're going to be taking multiple loads of laundry or groceries up and down a set of stairs, do your best to unweight your body as much as possible. You might have to take a few more trips, but adding extra load to the stair climbing can be a little more strenuous when you have pelvic pain. So modify stair climbing, or just try to avoid it if at all possible. Try to avoid taking large steps over objects. So think about, like, if you were trying to step over a hurdle and you'd have to hike your hip up really high and take a long step forward. Do your best to avoid things like that, or movements that look like that. So I tend to tell my patients who are exercisers with pubic symphysis pain to avoid things like side lunges, or really widespread, movements that cause that your leg to kind of come up and over and out to the side, traditionally kind of lunging. The other thing kind of functionally you can think about is we do this a lot. We step out to the side when we're trying to reach into high cabinets in our kitchen or in our bathroom. So if you have a really high thing on a top shelf you're trying to get in your kitchen, your best bet is to not step and lunge to reach. Your best bet is to walk over to closer to where it's in front of you to then reach from above versus reaching to the side. So you might have to make these little Pac-Man kind of pencil skirt-like movements, and change your patterns up the way that, you would typically do them. But it's better to just try to avoid those extraneous kind of sideways bending positions on the hip. The other things you can do is avoid long weight-bearing positions. So lots of sitting, lots of standing. Try to take breaks if you find that you're doing either one of those through your day. So if you have to stand for a long period of time, take sitting breaks or lying down breaks. If you sit for a long period of time, try to lie down or stand up. So switching your positions can be really, really helpful. The other thing you can do is when you're sleeping, we recommend you're traditionally side lying on your left side when you're in the later stages of pregnancy, but make sure you have a pillow between your legs. If you don't have a pillow as you lie on your side to sleep, the top leg tends to fall downward, and that puts a lot of compression and force onto the pelvis. And so just making sure that your legs are in a neutral position and widen them up with a few pillows just to get a little bit more support while you sleep. Any and all of those things can be really helpful when you have pubic symphysis dysfunction or pubic symphysis pain. Try some of the things at home. If you're currently in pain, always reach out to a trained physical therapist to try to see if there's anything they can do to help you. We love treating women with pelvic pain here because there's so much we can do to help you get more comfortable during your pregnancy so that you can have an enjoyable pregnancy and feel more comfortable without having to suffer in pain.